Hello everybody, I'm Chiara from Spezia Palazzo Vecchio and today I'm going to talk to you about osteoarticular diseases. Osteoarticular diseases are a leading cause of disability in the elderly, as most are the consequence of skeletal aging and generally have a chronic and disabling trend. The most common of these pathologies are arthritis, arthrosis, and osteoporosis. Let's start by defining arthritis and arthrosis, which are often confused with each other. Arthrosis is related to age and is caused by a deterioration of the bone cartilages due to the progressive loss of hyaluronic acid of which they are composed. This determines the onset of severe pain and joint stiffness, which loses elasticity and mobility, and in some cases is deformed. It is divided into primary and secondary arthrosis. Primary if the causes are constitutional. Secondary if it occurs in post-trauma areas or with localized pathologies. Arthritis, on the other hand, it is not necessarily linked to age and, unlike arthrosis, has an autoimmune inflammatory origin. That is, it is caused by the inflammation that cells of our defense system cause in the joints and other tissues. It therefore presents with all the classic signs and symptoms of inflammation, like redness, swelling, and heat in the affected joint. There are numerous forms of arthritis, in some cases related to systemic diseases, which therefore involve the entire body. These are, for example, rheumatoid arthritis, Gout, or lupus. Osteoporosis is a systemic disease of the skeletal system characterized by low mineral density and deterioration of bone tissue, with a consequent increase in bone fragility. There are conflicting opinions on osteoporosis. On the one hand, the deterioration of bone tissue is considered as a physiological condition related to aging. On the other hand, it's considered as a disease that does not necessarily depend on age. In fact, at all stages of life, bone undergoes a physiological remodeling process in which old and damaged skeletal tissue is removed by the osteoclasts and new bone is reformed by the osteoblasts. Osteoporosis should develop when there is persistent and greater bone resorption activity than that of neoformation. Osteoporosis affects women most, and this is mainly due to menopause. With the entry into menopause, in fact, there is a rapid decline in the levels of female hormones, estrogens, which is associated with an acceleration of the loss of calcium from bones. Let's see now what are the natural remedies useful in these cases. First of all, we have devil's claw, which is a root that acts as a non-steroidal anti-inflammatory drug without, however, having the typical side effects of this category of drugs. Thanks to the action of glycosides that inhibit the synthesis of pro-inflammatory prostaglandins, devil's claw has proven particularly effective, especially in the treatment of various problems of the osteoarticular system that cause pain and inflammation. Then we have Boswellia, also known as Franckincense essential oil, already used in Ayurvedic medicine as an anti-inflammatory and anti-arthritic. It reduces the synthesis of leukotrienes, which are substances involved in inflammatory reactions. This property makes it useful in arthrorheumatic diseases and also IDHs. A 2003 study showed that patients with knee osteoarthritis treated with Boswellia reported decreased pain, increased joint flexibility, and increased walking duration. Last, we have horsetail. Horsetail is very rich in mineral salts, in particular calcium, which constitutes the inorganic part of bones, and also is very rich of silicon. Silicon is essential for the formation of bone and cartilage tissue and for the synthesis of collagen, which instead constitutes the organic part of bone, helping to ensure skeletal solidity cartilage plasticity, and the elasticity of vessels and tissues. Vitamin D3 is the precursor of vitamin D. It promotes the absorption of calcium and the magnesium in the intestine, and increases their metabolism in bone tissue. It therefore helps to fix calcium in bones, contributing to the consolidation and preservation of bone mass even after menopause. Last, we have sodium hyaluronate, also known as hyaluronic acid. It is an essential component of connective tissue and cartilage. It acts by protecting the latter both as a lubricant and as a shock absorber. In case of joint problems and loss of cartilage, hyaluronic acid acts as a substitute and improves bone sliding. Well, we have distributed these active ingredients in 3 different supplements, which are: first, Arthorema block, which contain in Boswellia and Davis claw, and it is recommended for osteoarticular syndromes where inflammation is involved, therefore arthritis, but also has a painkiller for arthrosis. Then we have Cartilago. Cartilago, on the other hand, helps prevent the consumption of cartilage and the deterioration of joints for those who are already starting to suffer from arthrosis. Last, we have Magnesio Calcio Equiseto. It is useful for those who want to prevent osteoporosis, for women in menopause, or for those who already have osteoporosis and want to avoid its degeneration. As always, I remind you that before considering taking our supplements, it is advisable to download the product sheet from the link on the slide to consult with your doctor or with a specialist. That's all for today. Thanks for being with us. A greeter from Spezieria Palazzo Vecchio.